everybody, and welcome to the 2023 Global Health Leadership Conference Student Speaker Series. I'm Shoni Jain from Westview High School in Portland, Oregon, and today I will be presenting on the rising global health crisis, the shortage of primary care physicians. First off, a little bit about me. I'm a rising junior, meaning I will be in 11th grade in the upcoming year. Some of my extracurriculars include volunteering at the Oregon Museum of Science and Industry, mentoring in Oregon Health and Science University's Science Ambassadors, and competing in Host of Future Health Professionals, where my love for primary care initially started. Outside of STEM, I competitively dance on my school's varsity dance team, and I sing in a student-led a cappella group. My hopes for the future are to become a primary care physician myself, hopefully in obstetrics and gynecology or pediatrics, which is why I immensely resonated with this topic. So, where did my interest for this topic spark? Well, as I stated before, primary care is something I strive to go into, but that interest started from related research I did on the primary care field of family medicine through HOSA. Here I learned the urgencies of the primary care field and decided to look into why this was happening, its effects, and how to solve it. Before I start with a dive into the critical statistics of the situation, what is a primary care physician and what do they do? According to the Cleveland Clinic, a primary care physician is a doctor who helps you manage all aspects of your health. Their tasks include checkups and diagnosis, which are critical to your preventative health. The main types of primary care doctors are ones who we go to the most on a daily basis. They include internal medicine, pediatricians, family medicine, OBGYNs, and combined internal medicine and pediatric doctors. With that understanding, it is evident that without primary care physicians, our health systems would inevitably collapse, causing a global health crisis. Scaringly, this is a reality that is slowly becoming true. According to a Time magazine article, the Kaiser Family Foundation notes that 83.7 million people in the U.S. live in a primary care health physician shortage area, also known as a HPSA. This is due to the counting lack of 124,000 primary care physicians in the U.S. by 2034, according to the Association of American Medical Colleges. This is not only occurring in the U.S., though, as according to the World Health Organization, there is a global shortage of 4.3 million primary care physicians. The critical lack of primary care physicians causes negative outcomes on our global health. Not having physicians to maintain a society's health causes poor health outcomes to arise. Do you notice that when you try scheduling an appointment with your primary care doctor, they're booked out for months at a time? And also, on top of that, primary care residency positions are going unfilled. We're seeing the costs for healthcare rising, but a decrease in patients' quality of care. The American Medical Association states that healthcare spending has gone up $4.3 trillion in just 2021. This rise in cost will cause many citizens to undergo health poverty, which the American Academy of Family Physicians says can cause shorter life expectancies. So, you may be thinking, what is going on and why is this happening? There are many factors to this reduction in primary care physicians. The first phenomena is physician burnout, which we saw vastly during the COVID-19 pandemic. Physicians worked tireless hours, causing them stress, fatigue, and lack of seeing family members. In 2021, after the pandemic, 333,942 healthcare providers left their jobs due to these exact reasons. 18% quit, while 12% were laid off. Before then, there were other reasons for the primary care shortage. The primary care field sees lower salaries in comparison to its other medical counterparts, though they do more work in most circumstances. This, after extraneous time in medical school, may not seem worth it to most. The population of primary care physicians are also of the older demographic due to the lack of open access to medical education due to financial reasons and selectivity. The AAMC states that 45% of doctors are older than the ages of 55, and more than 40% of active physicians will be 65 or older in the next 10 years. To get a better understanding, I interviewed Dr. Faiza Sohail. She is a family medicine doctor who is the medical director at Kaiser Permanente Sunset Clinic and experiences these hardships of the primary care shortage firsthand. She confirms the fact that many of her staff quit due to physician burnout. But even then, oftentimes patients sometimes don't make it easier for them. She explains that she has been in cases where patients have yelled at her and her doctors when they are just trying to do their jobs. She also discussed how many people ended up taking early retirements after the pandemic because they physically couldn't do the job anymore. She also explained that even before the pandemic, time management was hard for the field, and to even come home and have a relationship with her children, she had to set proper time boundaries. Understanding these stories from an actual physician's perspective got me thinking on what can be done to fix this issue. So, what is being done as a solution? First are federally funded programs to assist with the financial burden of medical school. Programs like the Public Service Loan Forgiveness and National Health Service Corps allow for work in the public sectors to receive medical loan forgiveness in the US. Another solution is the spread of telemedicine after the COVID 19 pandemic. It also allows physicians to do their job in a lower stress environment and spend their time efficiently giving patients care through video and phone calls. So, what are possible solutions that we can create to help this issue? Increase of the accessibility of medical programs. The average medical school debt in the US is 200,000 plus, leaving many people not even considering the medical path as a career option. Creating more cost effective programs that may even be accessible online may allow a minority to pursue medicine. Secondly, increasing education about the medical field from an early age may spark more interest in future generations. Things like medical career fairs or a wider spread on hands on activities like cadaver labs for the high school level of students. Finally, reconsidering compensations for primary care physicians would be the biggest factor. Working with the local governments to educate them that the pay they receive is not that adequate for the work that they do. So, the conclusion. After this presentation, I hope it is clear to you that the epidemic we will enter globally if we don't work to solve this catastrophic global health issue. The lack of primary care physicians will not only affect our personal health, but create a domino effect for other factors in the countries we live in. I encourage you all, after you are done listening, to go look into primary care and see if it is something that interests you. Having one more person enter the primary care field will bring us one step closer to solving this pending issue. Here are my references I used for this presentation today. So thank you all for listening to my speaking today. I wanted to thank my teachers and advisors and Dr. Faiza Sohail for allowing me to interview and shadow her. Here's my contact information for further questions. Thank you so much.